First of all, it's my honor to participate in this meaningful activity. Today, my topic is a drawing before compressed tubeless uniportal VATS. There's no conflict. Okay, and I should mention that according to our experience, I should point out that some of the factors of the drawing, and here is the things I'm going to cover tonight. Now let's talk about the target and the spirit. So as we know, the Wright brothers built up the first aircraft, and when he was a trial, and the connection between the dream and the reality, that's drawing. So as we know that, Diago also built up the mobile medical unit, and connect the dream and the reality, I think, is a drawing. So as a thoracic surgeon, we know that there's a long history of the medical illustration, and especially in the Egypt and China. So as you know that one of the famous medical illustrations we can find it from the Da Vinci. And in the trachea surgery, and the father of the modern trachea surgery, Dr. Gill, and according to his 13 techniques of cranial reconstruction, most of the thoracic surgeons will follow this pattern to complete the cranial reconstruction. Another father of the modern trachea surgery, Dr. Madison from the MGH, also usually use a drawing to explain through the heart and hand drawings. So as we know that if one of the thoracic surgeons would push the tubeless technique, I think you can search some manuscript from Diago's manuscript, because I think for the pioneer, for the uniportal VATS, we should have the target, and we should also have our spirit. So I usually praise and we can learn about him, his target and spirit. So you can learn about that from drawing. So in a need for drawing for complex VATS or VATS procedures, you can see that according to this CT scan, maybe patient will receive the cranial reconstruction, but we should point out that we can follow many patterns of this drawing. So in our center, we should tell the companies and maybe the fellows we should not only learn about the basic research, but also learn the advances of the technique. So as we know that, we should point out that there was some limitation of traditional intubated uniportal VATS. That means if the patient just received the uniportal VATS, he should not only receive the uniportal VATS, but also should receive the intubation. And the traditional intubation will damage some trachea issues. And secondly, we should point out that the patient also should receive the medical ventilation, and some of the chest tube will occur some chest pain. So how should we do it? How should we make it better? That means non-intubated. In our center, we will let the patient to receive non-intubated anesthesia. That means the patient will escape the repeated intubation, and that means we will escape the relaxant or the muscle relaxant, so the patient maybe get a good recovery after the surgery. Especially in the complex surgery, not just like the trachea reconstruction or cranial reconstruction. And under the leadership of the Professor He, we complete the first case of the tubeless VATS trachea reconstruction. Let's share the video. According to the CT scan and bronchoscopy, there was a lesion in the intrathoracic trachea, and the pathology confirmed squamous cell carcinoma. And under the evaluation, we can make a correct margin. So we cut the distal and the proximal and got the negative margin. And during the osmosis, we can see that the patient just keep his spontaneous breathing, and without the costly intubation, we can complete cranial osmosis complete smoothly and safely. That means tubeless VATS trachea reconstruction. And as we know that for traditional intubation, cardiac reconstruction, the patient also should receive a cost-free intubation. That means the thoracic surgeon should stop his procedure and let the anesthesia to intubation again and again, so we can complete it smoothly, as we showed in the video. So this is the traditional cardiac reconstruction. And the thoracic surgeon will await the intubation. And repeat the intubation, so we can complete smoothly. And now, what should we do? In our center, we can complete cardiac reconstruction through unintubated. That means the patient just keeps his spontaneous breathing. And without the intubation, we can complete anastomosis. We can complete this compressed procedure smoothly. So let's share the video. Now, as the CT scan revealed that there was a lesion in the carina. And the bronchoscopy also revealed that after the neoadjuvant treatment, and the lesion is proper for the VATS cardiac reconstruction. Now the patient just received a non-intubated anesthesia. And from skin to skin. We also use the XI, the fluorescent, to evaluate the proper margin. Now, with the first step, we dissected the distal trachea through ROS. And after that, the second step, we dissect the right mid bronchus. And then I set the left mid bronchus. Now we can see that we set the whole carina, and the patient just keeps his spontaneous ventilation. Now we can complete this compressive reconstruction smoothly, without the intubation, without the ECMO. So you can complete it smoothly. Which has been published in the Annual Surgery in 2021. So we will connect the end-to-side of anastomosis from the left mid bronchus to the trachea, and after that, and the right mid bronchus to the neocarina. You can see that we just completed with the free the thoracic surgeons with the XI system. Okay, I should also point out that besides these factors, we should have the attitude and gratitude of the joint. According attitude and gratitude is especially important for the intern or the fellowship. So as we can see that we can complete the auto lung transplantation through the end-to-side anastomosis. I think that here maybe someone will maybe not know about the auto lung transplantation. So with the joint, we can see that we can anastomosis from the right lower lobe pulmonary vein to the stem of the right upper lobe pulmonary vein. That means the auto lung transplantation. So in our center, we also push the joint for compressed VATS or VATS procedures. And now we can share with all of you. We can complete the Uniportal VATS cardiac reconstruction through the end-to-side anastomosis. Through this drawing, we can learn about the tips entry. And we can also learn complete the Uniportal VATS for the pediatric trauma. So then, because minimally rest is important for the children. And in 2021, we published the non-intubated robotic assisted thoracic surgery for trachea or cranial reconstruction. And also, we use the drawing to share the experience of in our center. This is drawing. However, in 2021 and in 2022, under the leadership of Dr. Diego Gonzalez, we also published some of the manuscripts focused on Uniportal. We should point out that non-intubated uniportal robot-assisted thoracic surgery may be a new direction in the future. So just now, as I mentioned from the Dr. Diego, we can see that Uniportal was airway surgery, and this is Sure, and this is Da Vinci. And maybe through the drawing, we can learn about that Da Vinci just used to complete the cranial reconstruction 4 parts, through 4 parts. But now we can complete it just through 1 part. So I think through the drawing, we can learn more and more of the tubeless uniportal procedures. So I think the drawing is from the heart of the thoracic surgeons. So in our center, we also hold the exhibition of the medical evolution, which name is Galaxy. And to conclude that, in my opinion, drawing with the target and spirit. Drawing should learn about not only basic research, but also the advanced technique in the field. And drawing should belongs to attitude and gratitude. Besides these factors, I also want to point out that drawing should be with your dream and with your love, because to serve the patient better and better. This is our spirit. And as the drawing shows that, stay strong, but never lose tenderness. How to do it better? Here, for all of us, stay calm, keep calm, and think Uniportal. Thank you.